Hi, everybody. Sorry. Just waiting for someone else to join us really quick. Sorry, y'all. This is like my first live. Trying to invite somebody. Oh my God, amazing. It worked.
It worked.
Amazing.
Hooray for technology.
I thought it wasn't working for a minute.
Hi, Tommy.
Hi, Kevin. What's up?
Long time no see.
I know. I feel like I just saw you.
I know. We're just going to give it like a couple more minutes if that's okay.
Yeah. Hi, everybody. Thank you for joining us.
Oh, no. I
Friends.
froze,
Hi.
right?
You did.
Yeah, every time I switch to get the comment, it'll freeze.
Fun.
But let me just put the main comment here. All right, Tommy, so if you don't mind pinning that comment.
It has been pinned. Hi, Lisa.
Hi, Lisa.
Yeah. So whenever you want to start, you think you're ready, Kevin?
Yeah, I'm ready. We can get started. 6 o'clock.
On the dot, baby. Do you want to start or should I?
Yep, I can get us started. So, Tommy, thank you for having me over to join your live. So, just real quick, my name is Kevin. I work with you in the community health department at Whitman-Walker Health. So, as some of you may know, Tommy also works at Whitman-Walker Health. And if you don't mind, just introducing yourself.
Yeah. Hi, everybody. Thank you for joining this live today. My name is Tommy Sanchez. My pronouns are he, him, his. I work in the community health department with Kevin. My title is the community outreach specialist. So I go out into the community and we provide free HIV and STI testing to the community and just working with other organizations to provide, testing.
Got it. Thank you, Tommy, for that. And I forgot to share my pronouns. Mine are he, him, and his as well. So, all right, let's dive right into it. So, Tommy, as you may be aware, during the COVID-19 pandemic, we at Whitman-Walker Health, we've expanded our outreach efforts to include virtual outreach. So that includes social media platforms such as Instagram. And we talk about different topics, right? About HIV, STIs, sexual health practices, access to medical care. We talk about social determinants of health, public health interventions. And so our community health team, is just here to provide information and support and answer your questions. So at any moment, if anyone in the chat has any questions or comments, feel free to drop them. And today we're going to be talking about Mpox or monkeypox or MPX as it's known in some places. And we're going to be talking about our vaccine experience. we have gotten the opportunity to have gotten our Mpox vaccines. So Tommy, why don't you start us off with, talking about Mpox or monkeypox, about what it is and, just defining Mpox in general.
Yeah, just like a little brief overview of Mpox. Mpox is usually a self-limited disease with symptoms lasting from 2 to 4 weeks. Severe cases can occur that could lead to death, but that doesn't happen too often. Um, Mpox typically presents with fevers, rash, swollen lymph nodes, chills, exhaustion, muscle aches, backaches, headaches, and a rash. But the most noticeable ones that you've probably seen on social media are the pimples or blisters, that are on people's face, inside their mouths, on their hands, their chest, their genital, or the anus area. And it can also lead to other range of medical complications. So that's just a little brief overview. But knowing what we know about Mpox, vaccination access is also very important. So let's get into it. Kevin, can you speak about getting appointments for the Mpox vax, and how does one schedule an appointment?
Yeah, definitely. So right now, we are living through yet another virus. So it's a very interesting time, right? Because it leaves you wondering what's going to come next after COVID, after monkeypox. But right now, vaccination is really important, right? So if you're a DC resident, you can pre-register at the DC DOH website, DC Health, and you can then be contacted to schedule an appointment. It's really important that you pre-register. So you can try and get an appointment. Likewise, we recommend following social media accounts. Just if you live in places outside of DC, right? Because all of this information is changing in real time and it's changing really fast. So it's important to try and stay up to date. But likewise, another thing that's happening now that we just learned recently is that DC Health is going to be having walk-in appointments or just walk-ins for vaccination, right? And they have 3 different locations. We're gonna try and put them on the chat. But right now it's gonna be every Friday, right? From 12 to 8 p.m. It's first come, first serve. And you do have to be a DC resident, so you do have to have proof of DC residency, like a driver's license or a lease agreement or utility bill, something with your name and a DC address on it. And we know that through the power of social media, there's like a lot of information and resources being shared, not just for vaccination, but for testing and treatment as well, right? And so we at Whitman-Walker, we're also doing that as well for our patients and for folks who may have questions. I'm gonna try and post the phone number that we have because we try to set up a hotline, or we have a hotline where you can call us if you have any questions regarding monkeypox or vaccine access. So we're going to try and post those resources on the chat. But, in this live, Tommy, we're going to be talking about our experiences getting the vaccine because you and I, we both got our vaccines, which was really interesting. But why don't you share with us your experience, Tommy? Where did you have to go to get the vaccine? What was your process like for getting the shot for Mpox?
So I did what probably most people did, was just register on the Department of Health website, pre-register, because in the beginning it was pretty much hell trying to register and get yourself vaccinated. So they open up the pre-registrations, which was great. You register and then they will contact you when the next available appointments are. When I registered, they had option for 2 locations. One was a lot closer to my house, so I was able to pre-register for that location. And it was, super easy on the website. Just put your information and they contact you through email. I mean,
Awesome.
Yeah.
And
What about?
do you I'm assuming if you're doing through email, you might be wise to check your spam email, right?
Yes.
And
People have been informed to check your spam email, because sometimes the registration is sent to your spam. So if you don't see it, just make sure you look in your spam email as well.
got it. Thank you for sharing that. And so without, after you went there, you got your shot. Did you experience any symptoms, Tommy? Like, did you have any side effects? Were you feeling ill after you took the shot for
Um,
Mpox?
no, but it's funny. Everyone always asks, what are the side effects when it comes to getting vaccinated? Like, what's gonna happen wrong? And
Am I gonna
honestly,
turn into an alien?
right, get a third arm. Um, but no, getting the vaccination was easy. I didn't feel anything. I was able to work out literally immediately after I got my shot. Um, I did feel within like 48 hours a little bit of a soreness on my arm, but
Mhm.
nothing crazy. It just felt as if I worked out. I mean, Kevin, you also got the vaccination too. So like, what was your experience afterwards?
It was very similar. I didn't feel anything. I actually didn't feel anything when I was getting the shot itself. The nurse was amazing, so it was really fast. It was literally in and out, and then I wasn't feeling anything for that whole day, which was good because I had to still work. And then 24 hours later, I did start to feel like some soreness, and it lasted for like, I want to say like 2 days. And same thing, it felt like I had gotten a good workout at the gym for my delts, so I didn't mind. Um, and other than that, that's about it. I didn't experience any other side effects. Um, but I think an important thing, Tommy, to mention is that if anyone's concerned about side effects, or even trying to figure out if the vaccine is for them or if they believe they've been exposed, it's really good to reach out to your primary care physician if you have one and ask them those questions, and try to get more clarification or maybe just a peace of mind, right? Just like what we saw with COVID, like utilizing or using your primary care physician is really important to get more information and see if there might be any concerns that you could potentially have. But as we're sharing right now, it was very safe, very easy, very straightforward. Nothing really happened other than soreness in the area where we got the shot. Um, so thank you, Tommy, for that. Now we just want to really quickly jump into some updates regarding access for the Mpox or monkeypox vaccine. We have seen a couple things change, particularly here in DC. Um, and so, at the beginning they were saying 2 doses, then they were saying like 1 dose. Right now it's like, what's happening, right? As far as vaccination, is it 2 doses or 1 dose? But one important thing to note is that because there's a limited availability of vaccines for monkeypox, most people are getting one shot right now, 1 dose. And those who are immunocompromised, who may have like health conditions, for example, living with HIV, or living with sickle cell, they might get another appointment to get the second dose. But if you do not have any underlying health conditions, you will be getting just 1 dose. Some folks may have already gotten 2 doses because this started around June, July. Vaccines have been scarce, but this literally changed not too long ago. At least in DC, we went from 2 doses to 1 dose for the general population. Um, so, we just wanted to mention that regarding, the guidance around monkeypox, mpox vaccines. And of course, like all other jurisdictions, will have their own guidance, but for the most part, everything looks about the same. Just like in DC, um, you do have to be part of, one of those folks who meet the eligibility criteria, which we'll go over later on. But before we jump into that, Tommy, um, I guess one thing that jumps into mind is, you and I both got the vaccine, the shot. But what made you want to get vaccinated? Why
Um,
did you get the Mpox vaccine?
I mean, there's many reasons that I got it. One particular being that Whitman-Walker does work with Crew Club, which is a men's bathhouse. So we provide free rapid HIV and STI testing there. So I'm working very closely to individuals face to face. So that puts me at a high risk of, getting Mpox. So that was one main reason, in order to still provide for my community through the testing. I wanted to make sure that I was keeping myself safe. Other reasons were, thinking about my friends and family. I have people that I care about and love giving everyone hugs. That is like my connection through physical touch. And, you know, touching is one way to get Mpox from someone who has open lesions, you know, that's one way. So yeah, in my own personal health, just making sure that I'm staying up to date on my health for myself. Yeah, I mean, Kevin, like, what about you? Like, what was your reason?
Yeah, thank you for that. So just like you, I'm also a very physical person. I hug and shake people's hands. Although, of course, during COVID and the pandemic, we stopped doing that for the most part. Um, but for myself as well, I think it's a matter of being proactive about my health and protecting myself and those around me, because I also work with you alongside. So we do, we go out in the community, we provide HIV, STI testing. We're in clinic as well, and we do have patients and lots of traffic, in our clinics. Um, and likewise for myself, it was about trying to stay protected and, just, we're human beings, we're sexual beings. We have sex, right? So that's a thing that we do. Physical intimacy is part of the human experience. And so for myself, I just wanted to make sure that I'm protected, and that those around me are protected as well, right? So those are some of the reasons why I decided to get the vaccine. And just real quick, I believe we have some comments or some questions in the chat. And if you're joining us, if you have any questions or any comments, you're more than welcome to drop them by. But I'm just going to read one here real quick from Gulliver. I'm not sure if I'm pronouncing it right, but it states the following. What is Whitman-Walker Health doing as DCDOH's community partner to facilitate access to vaccine to socially vulnerable populations that might feel additional stigma and might not be out of the closet? So that's an excellent question, right? Because there's definitely a lot of stigma. Right now, we have seen some of the quote unquote branding for what monkeypox is and how it has been perceived as being like something that's only for gay men, right? Or folks who are identify as LGBT, or only being transmitted through sexual contact. But we know that it can also be transmitted through contaminated surfaces, including fabrics, right? And just by being in close proximity. Now that it's summer, it's super warm outside, people are wearing less clothing than usual. It seems like it's the perfect storm for something like this to happen. So as a partner to DCDOH, Whitman-Walker, we're definitely like doing a lot of education and giving out information and trying to help clients and patients as much as possible to try and get, signed up to get the vaccine. Right now, the biggest issue or challenge is that, the vaccines are very limited. Like we just mentioned, there are walk-ins that are going to be happening beginning tomorrow. But it's like first come, first serve, right? And even for us, it was still kind of sort of like, I guess we got lucky that we were able to get the vaccine, because not everyone has been able to get it so far. But one of the things that we can do to combat stigma, particularly around Mpox and vaccination, is to talk about it, right? To normalize vaccination, to normalize the
Education on it,
information.
staying up to date.
Exactly.
It's changing constantly.
Yeah, everything's just evolving so fast. Like I just felt like we're coming out of COVID and then something else is happening, another virus. And we did had the opportunity of partnering recently with DOH to provide vaccines at Max Robinson Center for a couple of folks, because we had limited doses through DCDOH. But right now, our job is mostly to talk about our experience as healthcare employees, and also, to provide information and education that, Mpox does not discriminate, right? It's a virus. You can get infected, whether you're heterosexual or you're bisexual or you identify as gay or lesbian.
Literally
basically
anyone.
Exactly anyone. Your sexual behaviors or sexual acts can increase your risk of acquiring Mpox, but it's not, it's not particular to a certain group. And so it's really important that we talk about that, and that we provide the information around how Mpox spreads. We have seen like a lot of comments on social media, people saying, well, I'm not gay, right? So I'm not going to get it. But it doesn't work like that, unfortunately. We're seeing on the news about children, unfortunately, some cases of children getting Mpox. And it's important that we talk about this, right? And that we try and advocate for vaccine access, particularly for myself personally. That's a big thing, as I am an immigrant, and with immigrant populations, whenever there's something like this, there's medical mistrust, there's misinformation, there's fear that your information might be used for other things, and so we're not going to be particularly receptive to the government. And so what we have to do, at least putting my health educator hat on, is just to speak about this, right? To bring it up at meetings, to push for our government officials to do more, and of course to share our experiences like we're doing here, and bring that information to other community members. I'm not sure, Tommy, if you have any other thoughts or comments regarding this question. It's a really important question because, of course, there's a lot of people that are still not out, and it's like when you go and have to line up and there's a bunch of other people there, you might see someone that's familiar, others might see you, or it might be like, oh, look, they're getting the Mpox vaccine. Like it's that stigma and that shame that unfortunately we're still seeing. And it completely sucks, right? Like it's not okay. Like we're in 2022 and, we're still pointing fingers, unfortunately. But do you have any thoughts or any comments?
No, that's you. Yeah, I mean, Whitman-Walker is doing everything they can in order to, help the community. We're learning just as much as everyone else is learning. We keep up to date. Information is constantly coming in and coming out, and we just want to continue providing that information to everybody who has concerns.
Thank you for that. And I'm so sorry. I just froze a little bit because I wanted to post our MBox hotline, 202-207-2480. So that's a line where you can call us if you have any questions, any comments, or any concerns, or if you want to talk more about this with someone. We're here. If you have any questions, comments, or concerns.
Yeah.
And there's more comments as well. Is Whitman-Walker as an FQHC going to be receiving any doses to distribute? So thank you for that question again, Gulliver. So unfortunately, at this point, we don't know. We would love it, of course, because we are very inclusive and we try to, have many different practices when it comes to privacy and just making sure that someone feels supported. But right now, at this point, we are not sure if we're going to be getting any. We just, unfortunately, have very limited doses in the US. And then, of course, another comment. Thank you. Yes, especially due to historical experimentation on people of color. And yeah, definitely, right? Because, we have seen, we actually had like a whole Instagram live series a while back about, just medical mistrust and malpractice in the US, and even things that unfortunately still happen today, right? So we have a long way to go to make healthcare more equitable. But the important thing to remember here is that, there's other people who are sort of like we're advocating for our own community, right? Because unfortunately, sometimes it feels like the government is not always going to be on our side for many different reasons, but we as a community, we got each other, right? So we have to hold our government officials accountable. And that's something that we're always trying to do at Whitman-Walker, to advocate for our clients and for our patients. And what are the hours for the hotline? So thank you so much. So it's from 9 to 5:30. You can call us. If we don't answer, you can leave us a voicemail and we'll do our best to get back to you. within 24 to 48 hours. So thank you for those wonderful questions and comments.
Yeah.
All right, Tommy. So yeah, thank you for sharing that about why you would get the monkeypox vaccine. Now, we sort of already touched about this, some trends around Mpox and vaccine access, the stigma and everything that's happening around it. Do you have any other comments or thoughts around some of these trends and stigma?
No, I mean, just keep yourself educated with the DOH website, the CDC website, our Whitman-Walker Health website. Again, we're going to keep you up to date as we stay up to date. So just, keep checking those websites out because you will continue to get information.
Got it. Thank you, Tommy. And I guess, this goes right into, once again, like eligibility for vaccination in DC. So folks are eligible in DC if you're 18 years and older, if you identify as gay, bisexual, or a man who's over 18 years old who has sex with other men, and you've had multiple or anonymous sexual partners in the last 14 days, or you're a trans woman or non-binary person who was assigned male at birth, who has sex with men, or a sex worker, or a staff member at establishments where sexual activity occurs, like bathhouses, saunas, sex clubs, and you will need to provide proof of DC residency, which includes like a DC ID or a utility bill or a lease with your name and DC address. It can also be a mortgage, or like a lease, like we mentioned. And we also have the website for the walk-ins, because there's 3 different locations. There's one on 3640 Martin Luther King Jr. Avenue Southeast on Ward 8. There's the 7530 Georgia Avenue Northwest on Ward 4, and the 1900 I Street Northwest on Ward 2. And it's very important that you bring proof of DC residency, and residents will be asked to attest that they meet the eligibility requirements, right? All right, froze again. Let me just try to copy and paste the link for the walk-in Mpox vaccine clinic that DCDOH is putting on. All right, back here. And so the website is preventmonkeypox.dc.gov for the walk-in vaccine. And then we have another question or comment that it says that it's important to truthfully answer the eligibility form, not to limit access to someone who might really need the second dose. So yes, thank you so much for that comment. So this is only for folks who are getting their first dose, right? So if you've already gotten your first dose, you're not with immunocompromised, or you don't have any underlying health conditions, you just stand by, stay tuned. When guidance changes, or if it's still recommended to get the second dose, if you're not sure, we recommend that you reach out to your primary care physician, your doctor, so that you can get more clarification and information if there's any questions or concerns surrounding the second dose, or even for the first dose as well, if you have access to a medical provider. Likewise, you can call us to our MBox Hotline at 202-207-2480 if you have any questions or comments or concerns. So yeah, that's pretty much it. We talk about our experiences getting the vaccine, some trends, stigma, who is eligible to get the Mpox vaccine. Now, Tommy, do you have any other thoughts, any other comments regarding monkeypox or vaccine access?
No, there's a friend named Grant Roth who created this spreadsheet of all the states on who to contact and where to go in order to get the vaccine. You can either send me a message. We'll try to put it on this live. It's very informative. It's of the many states, and information that will help you get the vaccine as quickly as you can. So just keep a lookout for that. It's very good. So I thank you, Grant. That's very well. But other than that, just continue staying safe, staying healthy, protect yourself. If you're seeking any sort of help, questions, comments, concerns, always reach out. And just, yeah, keep yourself well informed.
Thank you, Tommy, for that. I tried to put the link in there. It is a Google Docs document. So it's a long link, but it's a really good resource as well. Maybe we can make a post and put that link in there so that folks can try and access it. But thank you for having me over, inviting me for doing this live to talk about monkeypox and the vaccine access. And once again, just real quick, another quick plug. Whitman-Walker, we're still doing HIV and STI testing. And so you can call us at 202-797-4439 to schedule an appointment for HIV and STI testing. Likewise, if you have any questions around Mpox vaccine, testing, treatment, you can call us at our Mpox hotline at 202-207-2480. So thank you, everyone, and have a wonderful evening, and stay dry out there because it looks like it's about to start raining eventually with DC weather. We never know what we might get, right, Tommy?
Right.
Definitely. So thank you, everyone, and have a wonderful evening. And thank you, Tommy.
Thank you, everybody. Yeah, thank you for joining me.
Take care.
Bye, everyone.